Hey, what's up, guys? It's Coach Gaglione here. This is another edition of the Powerlifting for the People podcast. I'm your host, Coach Gaglione. I've been involved with powerlifting and strength coaching for over 15 years. And today we got a really special episode today. We're going to talk about things like health, longevity, blood work, testosterone, all those crazy buzzwords. So we got the gang from Coastal MD here. So really quick, just a little background. And I'll kind of let you introduce yourself and kind of talk about your services. But there's been a lot of kind of telehealth and hormone clinics and all these different things kind of going around. So we want to get like a local facility to Long Island on the call today to kind of talk all those things health, because a lot of people are really not sure where to start. If this is for me, is this, what is this for? So I'll let you kind of take it away and give like a little intro on who you are, what you got going on, and then what your company is all about.
Yeah, of course. And thank you for the introduction and for having us on here. We love getting the word out and spreading, about what we do. I'm Justin, one of the main PAs here. I'm also the CEO of the practice. We have 3 locations currently. We're working on a 4th location, which should be open up at the start of 2024. And what we're trying to do is we're really trying to put a whole new spin on the way medicine and health and longevity and vitality is really kind of observed. Ever since COVID, there's been a big shift on, how basically the medical profession is kind of viewed and really what people are looking for, in their medical treatment, right? People have become more health conscious. However, they don't want to just go the traditional route with everything per se. So what we do, we're an integrative health practice. And what that means is that we're able to combine conventional medical therapies that are tested and true with some alternative therapies that play very well and are synergistic with it. For example, like we don't do any sort of we do non-narcotic pain management, right? So obviously we know there's a big opioid epidemic right now. So, we steer away from that. And what we do is safe and effective and there's 0 downtime. Those are called trigger point injections. And they're a little bit of lidocaine with something called Sarapin, which is a plant-based anti-inflammatory, which is awesome. And that helps increase blood flow to a certain area. And I'll go into a little bit more about this, John, when we're talking more about the lifters and things like that. But essentially, what we're trying to do is provide people with a space that is familiar, inviting, and has the highest quality of care. Because like you mentioned, there's a ton of buzzwords out there right now about a lot of things in this space. And a lot of it is, in other states, down in Florida, it's across the country. We're located right here on Long Island, so it's good to see a familiar face, and you can't beat that one-on-one, in-person interaction.
So just really quick, because I know like a lot of our listeners are going to be local, but obviously I know we mentioned kind of off air, and I'm not sure how much you could talk or not. Maybe that at some point there may be like a telehealth component.
Yes. Yep.
But for those that are local to Long Island, like where is like your main office, just so they know, and for people that are maybe interested, and obviously we'll kind of get into specifics and talk and give you guys some take home. If you are listening, that's outside of, we can kind of maybe tell you, give you some ideas on like what to look for, what to watch out for. So where's like your main office located right now?
Yeah, so we have 2 that are considered our main offices. One being right down the road from you, which is in Melville, just north of the LIE, right near Blackstone Steakhouse is usually a pretty good landmark for the people that are local. And then the other one would be in Bohemia, right on Sunrise Highway, very, very accessible. And then our 3rd location is our Port Jefferson location as well. And then our 4th location that's going to be opening up is going to be right near Riverhead, all the way out east. With that being said, we're actually working on something for Nassau County as well. And then, like you mentioned, I actually had a meeting yesterday for our telehealth provider. That way we can, start to roll that out over the next couple of months. So that is something that we are going to be adding in the very near future.
Yeah. So I think, so we'll kind of get into this and we'll just let the conversation kind of flow organically. We were kind of talking a little bit off air about, in powerlifting, there's many like divisions, there's many federations, which it can be a little bit, just tough for me as a coach, because it could be tough to manage a lot of questions when people are coming in. They're not really sure like what meet I should do, what federation I should do, what the rules are, what's allowed, what's not allowed. And traditionally like powerlifting, when I kind of got involved with it, you think about like the big guys, the beard, the tattoos, the big meatheads. And what we're kind of seeing more and more is we're seeing a lot more youth lifters get into the mix. We're seeing a lot more masters lifters, 40, 50 plus, 60 plus. We've had some lifters like upwards of 75 compete, which is pretty amazing. And I think part of that is due to like, people are getting more savvy with like lifting weights is good for your bone density. It's good for your muscle
Yep.
mass. It can be a healthy part of, depending on like how to what level you do this, it can be a healthy part of like whether it's a hobby, a routine you do with your buddies. That's kind of what we're doing at Gaglione Strength. We're trying to like make it like, meet on the bench. Let's deadlift with our buddies instead of going to the bar on Friday night. Just a more healthy activity.
Yep.
But you still be, maybe you were a former football player, maybe you were an athlete. You still want to kind of scratch that competitive itch. That's kind of like why I got into lifting and been competing for so many years. But at the same time, we do know when you take things to a higher level, it can be a stress on your body. It still could be demanding, but we want to make sure that we're kind of getting all the benefits from lifting, but maybe mitigate some of like the risks and the downsides. So I guess in your view, like if you're, whether it's looking at blood work or you mentioned some like kind of like, I know you have like the different IVs and stuff.
Yep.
What are some things that like lifters can look at in order to maybe if they want to, maybe be a little bit healthier, maybe stay in the game a little longer and maybe mitigate some of the risks associated with maybe some of the heavier, the more competitive lifting?
Yeah, absolutely. So a lot of good points to touch on there. With the stresses that you are putting underneath your body, I believe in more of a whole body approach, right? So that does start with blood work. We do a very comprehensive panel. We do everything from vitamin testing to hormone testing, and then indoor organ function testing, right? So checking your kidneys, livers, all of your red blood cells, white blood cells, everything that we can kind of put together from a comprehensive point of view. That way, when we sit down, we could look to see like, hey, listen, your liver function is actually creeping up a little bit. Like, what's going on here? Because I'm sure in your sport, and I've seen it before, you guys all have very high muscle density, right? So with that comes a bigger strain on the kidneys, right? So that's where IV hydration kind of plays a part as well. Naturally, the more muscle that you have on your body, the higher that your kidneys are going to be put underneath that stress, right? And it's just because of the added protein that's circulating around in your bloodstream. So we do a combination of different IV vitamin therapies that are really beneficial. One of my favorites is glutathione, which is just starting to become very popular right now. Major antioxidant. The benefits with it are, endless. But the thing with it that's very interesting is that really the only way to absorb it at this current time is via IV. There's some newer products out there that are claiming, you could take them orally. However, I don't see the research being there just yet for the effectiveness of that, because you really want to look at bioavailability and how much are you actually getting when you're doing something like that. Something else that's important in the blood work that we checked that you actually touched on, and we talked about this offline too, was really about the bone density and the training that you do, how it drastically helps that. Vitamin D. I could almost do a whole podcast on vitamin D because of how much it plays into bone density, right? Because your body will not effectively absorb the calcium unless your vitamin D levels are adequate, right? So another reason why I look at it is actually for the hormone side of things. It's a precursor to testosterone. So we do take that into account when we are checking testosterone levels in men to see, like, listen, do you have enough of the building blocks to just even start creating the testosterone naturally on your own? Because people could have different reasons why their testosterone may be lower, whether it's a production issue, maybe you just don't have enough of the products to actually make the testosterone, or maybe you're not converting well enough. So these are where we look at the different stages of the testosterone, which is obviously something that's very important to gentlemen as they get up in age. I mean, scientifically speaking, after the age of 30, testosterone actually starts to decline. The rate at which it declines varies based off of the individual and the genetics and external stressors too, right? I guess we don't need to get into it now, but there's so many other stressors out there, environmental stressors that can really affect hormones and be like a hormone disruptor, right? So that's one thing. Blood work, that's something that we really want to look at. We want to make sure kidney function is great. We want to make sure hydration status is going really well. We offer other vitamin drips as well. Myers cocktail is very popular too. It's been known since easily the 80s to be very effective at treating multiple disorders, everything from musculoskeletal issues to autoimmune, to even now the newest thing that I'm using it for is actually long COVID symptoms in a lot of people. That's one subset. I think the other thing that's really important to note too is for longevity, especially in your sport, with the strain that you put your bodies under, is addressing any musculoskeletal issues as soon as they come on, right? So what we do with the trigger point injections and medical massage is that we're able to use them in combination with one another. There's zero downtime to them. You can go hit the gym right after you get a treatment. There's zero side effects to them. I love it. And, we've been able to help so many people stay at the top of their game because you're providing them with these myofascial releases and this promotion of healthy muscle tissue so that they can continue to play their sports, to do their weekend activities, and just to live an active life, which is really, really huge. And then I think something else that's really important for your demographic and for powerlifters in general would be peptide therapy. The trigger points and the medical massage, they're kind of like an acute treatment, if you will, right? So like you came to me and you're like, Justin, my shoulder is really bothering me, or my hamstring's really bothering me. I would start you with the trigger point injections and the medical massage. However, we should think more long term with some things. There's peptides out there that promote healing, such as BPC 157, very targeted, but I think has a major play, especially with your followers at your gym, as well as something like TV4, which is a longer term play, because that's more of a systemic peptide that's going to help promote soft tissue healing throughout the body as a whole, which is really incredible. And between you and me, I think I mentioned this to you when we were talking in person. This is the direction that medicine is heading. People want that peptide. People want that more natural way of doing things to elicit this response within inside the body that's going to help promote that healing. So what we would want to do is take the lifter as a whole and try and do a combination of these modalities, because when you combine all of these together, that's when you're going to get your peak performance or your ultimate vitality, right? So really, what's vitality? It's energy, right? And what we need here is energy. We need activity, and that's what we want to try and promote. So I love talking about this type of stuff. I think the population that you have following you, they're who we like to treat. Our patients, our demographic are people who want to get better or people who want to do better for themselves, right? Which is exactly what you have as well too. Like people that are looking to compete, people that are looking to be at the top of their sport, stay active and do something healthy to promote their overall health, right? So I think that's really where we line up quite well. So that's why I'm excited for this upcoming event too.
Absolutely. So there's a couple of like things I wanted to touch on that you mentioned. So number one, I think that I always just like to use the analogy also when it comes to training, but I think it goes along with all these different types of therapies, medical interventions. You want to be like a sniper versus like throwing grenades, So I think the blood work really kind of allows you to kind of be more of a sniper and kind of obviously having a medical professional. Because obviously you could like look at, I don't know, like what's a good vitamin D level? What's a good like testosterone level? What's the ratio of this? What does this mean? So I think the first thing is kind of just getting a baseline of data. And then obviously the more data points you have over time, you can see the trend. And then you can kind of make some educated decisions. But even like you mentioned vitamin D, a lot of us are working from home. We're doing the Zoom call like on the computer. So we maybe not getting as much sunlight as normal as before and things like that. So all these factors kind of come into play. And you would think something like just like a vitamin D level, but that could really affect your energy levels and kind of, like I said, are you producing enough testosterone? How is it affecting your sleep and your energy levels? So all these things kind of come into play, whether your focus is more health or your focus is more performance. But obviously, if you're healthier, you're going to be able to compete for a longer period of time. So that there might be some younger people listening to this. Well, I mean, I don't care about longevity because I'm 25, but that extends your career, your lifting career, another 5 to 10 years. So you got to think about what that's going to do on the back end, and also when you're done competing, like how's your body doing? How's your joint integrity? Like, is the bone density still good? Is your muscle mass still good? So with
I'm
that,
sure you could talk about that end of the spectrum, right? Especially for the younger followers, like I'm sure you've seen people that really pushed it to the limit, didn't take care of themselves for the long term, and now they're paying for it, right?
yeah. So I mean, I've been competing since 2006. I've been involved in the sport since then. So and the first time I touched a barbell, it's been like over 20 years. So I've seen a lot of folks come and go. Some people that were really great lifters that just were a flash in the pan. So depending on like knowing your goal and knowing your audience, but I know like the people that we work with, a large percentage are 35 plus. they have families, they have other jobs, they have other obligations. So I think for those that have additional life stressors, it's even more important to kind of make sure that like the health is in check, the blood work is looking good, because obviously that's going to make an impact on your recovery. And I think the stronger you get, the more important the recovery, because if you can't recover from the training, you're only going to be able to get so far. So, um, in terms of like maybe for the younger people, like, is there like a good time? Like, can anyone get the blood work done? Does it have to just be an older person, or like who is this for? Like, what would you say to like maybe to that?
It's a great question, and a lot of what I've actually seen through our practice is that over 80% of our patient following actually doesn't have any sort of primary care follow-up. So I'm going to say everybody, just because I know that it's so blanket that enough people aren't being checked just for baseline things that are going to creep up onto you at a much later time, right? So if we could catch these things early, such as, kidney function being elevated, something going on with the liver, if the LFTs are being elevated, why is that going on in, say, a 26-year-old that's healthy, and at least we can jump on that much earlier than them finding out down the road, right? So I think anybody who's really, competing, starting to really get serious about their health, and they really want to, be serious about the sport, that's the perfect time to get checked, right? Because even if, and this is the ideal case scenario, blood work is pristine, now you have a baseline, and that baseline shows that, listen, I didn't have this problem 6 months ago, 12 months ago, 18 months ago. God forbid something does pop up, so that's why I always recommend a very comprehensive panel just as a starting point, right? So we can, and what we do is we fine tune and we tailor the treatment plans based off of, what we see on the blood work, because this is a long-term game. This is not a short-term game. And that's how we want to approach everything. Obviously we have solutions for both, but I think anybody who's really starting to get into the sport, as well as those that have been in the sport for many years and really just want a different perspective on their health and their blood work overall, would be excellent candidates for it.
So this is kind of maybe it's a little bit of a loaded question, maybe not, but I do want to talk about testosterone a little bit just to educate people.
Okay.
There's still so there's kind of a couple different camps, and I think there's probably more than two camps, but I think it's becoming more accepted to have like some sort of testosterone therapy. But and I'm not sure if you're aware of this or not. I don't remember if we had this conversation when we met in person, but one of the things that I'm not sure if this is good or bad or whatever, but people are becoming aware that testosterone replacement's a thing. It could be a very healthy thing to, get testosterone, especially if your body is not at a good level. And you could kind of speak to maybe what a good or bad level could potentially be, because obviously you have to account for symptoms, you got to account for the individual. So there's not going to be like a one size fits all. All this is going to be very individual, and you could speak to that. But what I've kind of also seen is that sometimes you have some of these fitness influencers that are like, well, I'm not taking steroids, but I'm on TRT. And then you kind of maybe,
Yeah.
so it gets a little bit muddied on like what TRT actually means. So maybe because I think, and then there's still a stigma like, well, if you take any testosterone, that's cheating. So obviously, maybe if you could explain the difference between like, performance enhancing drug like abuse and,
Yes.
and testosterone replacement, because I think there's still like kind of, it gets a little bit muddy, especially for like the lay person. They don't really understand,
Of
is this
course.
is this person cheating, or is this something that could actually benefit my health and give me vitality, and not like maybe have these like negative side effects that we've seen in the media for so many years. So if you
Yes.
maybe, I think this is like an important conversation for.
I completely agree. And I really appreciate you bringing that up too, because when you were talking earlier about just the powerlifting sport as a whole and really the stigma that it used to be versus the utility that it has now, it's just, you have such a broader base now, right? And the stigma has kind of changed, the stereotype has changed. That's the same exact thing with testosterone replacement therapy, right? So I would say a little bit greater than 10 years ago, it was exactly what you're describing. Like a lot of people had this image of guys getting it out of the duffel bag at the gym and, injecting in the locker room. And it's come such a long way, which I'm very happy about because we do so much of it here and we really do it the right way because I see its effectiveness. I see how vital it is for so many people, especially in this day and age. So really just to dive into it, obviously you need a baseline screening to see where your testosterone levels are at. We need to check symptoms, all of that, because sometimes symptoms and testosterone levels don't correlate. And that's something that I think is where the stigma is starting to become more apparent, is that you need to treat the person and the numbers are kind of your safeguard, right? And what you want to be doing is you want to be able to achieve the max amount of benefit with the least amount of side effect or symptoms. Now, why is that important? That's important because when you're doing it the right way and having medical following and a lot of like a set regimen plan, that's not what was happening out on the streets. That's not what people were getting before. And that's where, these social media influencers and things like that are not really portraying the real image of what HRT or TRT should be, right? So testosterone replacement therapy is going to be using exogenous testosterone in that treatment plan, right? So we practice HRT, which is hormone replacement therapy, which can include testosterone within it, right? It's a subset of that. However, everybody is different, right? So what I do for patient A, I may not do for patient B. And the reason being is that one, there's different causes for it, right? Why people have lower testosterone. And the other important thing that is another separate stigma that I think we have to debunk and kind of go into is fertility, right? So the biggest question I get asked is, if I go on this, am I going to have to be on this forever? And then the second one is, if I go on this, does this mean I won't be able to have children? And the answer to both of them is, well, depends on the situation, right? So it's all about context. And that's what I'm glad that I'm able to do on this podcast now, is be able to share this context. So the first question of, if I start this, am I going to have to be on this forever? That is usually for testosterone, TRT replacement, right? Exogenous testosterone supplementation. And the answer is, and in the context is, if you need it, meaning your numbers are low, you are symptomatic, and you are a candidate for testosterone, yes, you will have to be on it probably long term. But the reason is because if you come off, you're going to be at the numbers that you were at before, still requiring it, right? It is a requirement. In the other context of, hey, listen, I'm looking to just kind of increase my performance, I'm on the borderline of actually being a candidate or actually requiring it. Yeah, you may be doing yourself a disservice to take exogenous testosterone and now make your body a little bit more reliant on. That's what people think about all the time. However, I think what you're talking about and what I am promoting is that in this day and age, a lot of people require the testosterone because their level is getting so low. And that's where it's actually very beneficial, because you're not, this is what you were talking about before, you're not exceeding the upper limits of normal. You're getting back to normal, right? And the analogy I think I gave you when we were talking in person was, a diabetic is taking insulin. Somebody who has low thyroid hormone is taking Synthroid, which I know that's not an exogenous hormone. However, it's the same principle, right? You're getting your hormone levels back in check. And that's really where your body wants to be, right? Your body doesn't want to be at low testosterone. It's, there's these external stressors, there's your own cortisol levels working against you. There's a lot of different things out there. So to that other candidate, to just piggyback off that point, there's the other side of HRT in which we're just promoting more of the natural production, right? And that's usually done through HCG, human chorionic gonadotropin, or something like Clomid, right? Which that is telling your body, hey, let's send a message from the brain down to the testes. Let's produce more testosterone. This is more of our own. And it's promoting that actual, that flow and that cycle, as opposed to when you're supplementing TRT or testosterone exogenously, it's kind of interrupting that negative feedback loop. So that's one of the big things that I think people need to understand between the two, right? But I see such a value in it because you're getting people back to their sweet spot, and what's changed from the old stigma of TRT or HRT to now is that you're not just exceeding past normal, which with no boundaries, right? And that's what was being done. People were just dabbling. They don't know what their levels are as they're on treatment. We do blood work every 8 weeks. We're checking your levels all the time. We're also checking for any adverse side effects that could be happening. That was not being done 10 plus years ago, and that's why it's becoming so popular, because people are seeing such utility in it, and it's really changing lives. People are losing weight. People are increasing in their energy. They're increasing physical activity, because as you know, obesity is a primary disease, which we try to tackle. There's over 200 linked diseases to obesity, right? And even if you're getting testosterone and you're becoming more active, you're in turn going to be healthier overall, and then thus hopefully lower some of those other adverse comorbidities that you could be having, so something definitely to keep in mind for sure.
Yeah, I think the other thing I want to, maybe, because I know I want to make sure we're good on time, but I want to dive a little bit deeper. So a couple of things here. So I think that number one, maybe if we could talk about if maybe like they're not local to Long Island, we don't have the telemedicine stuff yet. So something that I've seen with certain people, and then maybe you could speak to this a little bit, and you can get as specific or as general as you want. But I think there's definitely a stigma. Sometimes you go to these clinics, it's like, oh, I'm just gonna like, get my testosterone, and then I'm gonna get like jacked like in 2 seconds. And
Yeah.
the other thing, maybe you could also speak about like when you're looking at the blood work, I'm sure you're gonna be adjusting the dose, titrating maybe up slowly, or maybe even pulling backwards, adjusting the frequency of the shots, because that could really, all these things. Working with a professional, like what are some things to like look for, or like some red flags, like as far as like, because I've seen some horror stories where some people just get a really big dose and then they don't get another one for a while, and then their mood goes really good and then it crashes down. So if someone is maybe kind of thinking about like doing this or going to a clinic like this, like what are some things to look for, and what are some red flags for like as far as like best practice or things to avoid when you're kind of going down this route?
Yeah, of course. And first off, I just want to say, if you know of anybody that would like to get in touch, just that's out of state, say not local, please just put them in touch with me. You have my contact information. More than happy to speak to them one-on-one as well too. But excellent question. I can easily dive into that because everything is relative and should be specific for the person. If you're going somewhere and it's cookie cutter, it's hey, here you go, there you go. That's not what you want, right? So you need that blood work as a launch off point, right? So you need to see kind of where you're at. And then the big thing from that point is the titration. If you are super low, your titration is going to be higher, meaning it's still going to be between a 2 and 4 week titration up, meaning every 2 to 4 weeks, you're going to be increasing the dose in some stepwise pattern. But if you're kind of, say, in the mid range, which in the labs that we use, and something that I want to throw out there too is you have to be very specific in which labs you use, right? And the reason being is that their reference ranges vary slightly between, say, like LabCorp, Quest. Those are two very well-known ones throughout the country. Their numbers are different for what their reference range is. So like a 500 at Quest is not a 500 at LabCorp, right? So consistency is key when it comes to HRT. Consistency with the day that you inject, consistency with the provider that you see, consistency with what the product that you're getting. So I promote testosterone cypionate for the reasons that you just mentioned. It gives me the best ability to fine tune and titrate dosages based off of blood work and symptoms. Another big thing that people should be aware of is how frequently you're meeting and getting your blood work checked. 8 to 12 weeks is really the sweet spot to stay within a safe harbor of catching any side effects. I know that there's some people out there that may disagree and say, 6 months or 8 months or 10 months, but the amount of, elevated hematocrits that I've found, which is putting excess strain on your heart that you do not need, the rises in PSA, prostate specific antigen that I've caught and, have led to further workups. These things need to be tracked between 8 and 12 weeks on the regular. Anything longer than that, I feel like is a little bit out of the safe harbor zone. And you run the risk of developing some of those adverse side effects, such as gynecomastia, breast tenderness, nipple tenderness, polycythemia. The list goes on and on for some of these. So you really want to make sure you're consistent. I love testosterone cypionate. Like I mentioned, it gives great ability to fine tune your dosage. But you also have to be weary of people who aren't really digging into your side effects that much, right? So some of those ones I just mentioned to you, chest pain, shortness of breath, breast tenderness, nipple tenderness, even just slight, those could be signs of increased estrogen. You may have to be on an estrogen blocker, which is extremely common, right? I'd say over half of my HRT patients actually do take an anastrozole or a Arimidex as a way to combat the rises in estrogen that are going along with that. So, I like once a week dosing. Yes, there's pellets out there. Yes, there's creams. I think in the male population specifically, the IM injections are the way to go. I think for females, pellets are actually more preferred, just due to the steady state in which they're at and the levels that they're trying to obtain. But the levels that men need to be at compared to women are different, and they do vary. Plus, you're juggling other hormones when it comes to women as well too. Um, with that being said, dosing is important, and I go back to consistency. Once a week is a great place to start, but then that interaction that you're having with the provider, that's why it's so crucial to meet at least once a month, right? Because if you're starting to develop certain side effects, such as acne after injection, or you're noticing like 2 or 3 days before your shot, you're just bottoming out and you're crashing. That's when something like dose splitting would come in and actually be very beneficial, because instead of having that, just means your body's metabolizing it very quickly and you're getting a sharper peak and drop. Where if you dose split, you get more of a steady state that's here, which is ultimately what you're trying to achieve with the injections. So I hope that answers your question. Does that?
So I think just for people that are like, number one, if everyone's like kind of getting the same like TRT like plan, like that's a red flag,
Yep.
right? If everyone's
Yep.
getting like, oh, you're on 150 a week or 200 a week, and then
Yep.
you're good. Like you said, maybe some people need 75, and I'm just throwing out these, don't like,
Yeah.
you know, X, maybe we're gonna split the dose into twice a week, and then that
Yeah.
person is now got better. They have more sustained energy. It's like if someone might be fine with, less free, like you said, less frequent, and maybe they do fine with the, everyone's different. So if
Yeah.
everyone's kind of getting the same plan from the same doctor, that's a red flag. And I would say also, like, if they're only
Yeah.
meeting you like every 6 months, those side effects can come on quick. And then what are you going to do? Now you're going to have to like kind of, really scramble.
Yes.
So I think the more
Yes.
frequent meetings is going to be key. So the last thing, yeah, go ahead.
Well, I was just going to say, I've seen that before too, where I get people from other practices that say have the doctor, he only wanted to see me twice a year. It's like, you have a renewal of your prescription. Like, how do you know if you need to be? That's like the biggest red flag that I see. So that's just one I wanted to add in there too. You're right with that.
So these are just some things, because I think people like, people are starting to like, this is getting more popular. So,
Yes.
there's going to be more options. So you got to, like, with more options, you got to
Yep.
scrutinize a little bit, like who you go to. And obviously that's why, you're on the call today, because obviously
Yep.
we had a good conversation, and we're on the same page here. So I
Yes.
want to be mindful of your time. So one last thing, and then we'll close with just like your contact info and all that. This has been a great conversation. We'll definitely continue,
Yeah.
chatting. And if you guys have more questions, if you guys want us to do this again, you guys could, follow up and, send us some messages. But so like we mentioned before, like off air, there is there's tested and untested powerlifting. So obviously we just had this whole long talk about testosterone and all this stuff. So obviously, like, you need to compete within your rules of your federation and
Yep.
all that. So we're not saying to cheat or whatever, but at the same time, what's great about powerlifting is there are options if someone is, maybe they have a health concern or whatever, and they need testosterone replacement just to get up to baseline. They're still going to be able to compete, and, in a healthy way, and
Yes.
under the rules of their federation. But a lot of the things that you did mention, like the IVs, like the vitamin therapy. So even if you are a tested lifter, and maybe, getting on TRT would, potentially break the rules of the federation you're in, there are still a lot of treatments that you could do, and the blood work would still be very valuable. Because I think sometimes people get scared about like needles. Is this legal? And if it's not a banned substance, like just like creatine and protein powder, like all these things, you could argue, are they natural? But if they're allowed, if it's going to help your recovery, help your health, take advantage of every stone that you can unturn. That's what I would say. So just be open-minded to learn more about these methods, and obviously talk with your provider. I compete, in this sport, I compete with this federation. This is what I'm allowed to do. And then they could work with you, and, Coastal could work with you on whatever, if you're a tested athlete or an untested athlete. There's a lot of options to maintain your health and longevity, no matter what federation you compete in. So I wanted to just make sure that was clear.
Yeah.
If you have
I
any,
think that's it. I think that's very important too, John, because I played college soccer. So the NCAA, they had a list
yeah,
of banned substances, right? Bring that list. If you're coming in or you're going to see another provider, bring that list in and be like, hey, listen, this is a great treatment plan. I love it. Are any of those things that you just mentioned gonna be on this list? And hand them the list. That way there's complete transparency, in what you're getting,
and at the same point, if you are, like, some people are not even aware, so educate yourself, because you could potentially take too much caffeine or cough medicine, and I've
Yes,
seen,
yes.
so like there's stuff like some people are not even aware of, like, there's certain, like, compounds. If you are in excess of certain ranges, you can kind of pop yourself from having too much Sudafed or whatever. You know what I mean? It
Yep.
might, so it's just good to educate yourself and just make sure you guys know what you're getting into if you are going to compete at a high level. Because I've seen some horror stories of people get their records taken away because they just were unaware of these things. So, but I really appreciate the time. I can keep talking to you for hours,
I know
but
this is great stuff. This is
it's
great
really
stuff.
it's exciting. And like I said, I think for me, personally, like I want to be an advocate for the sport. I want people to do this in a healthy way because I do believe that powerlifting can be done in a healthy way for a long time. And especially if you kind of experiment with some of these interventions like you were saying,
I
Justin.
agree.
Just really quick before we close out, where can people find you and if they want to check out what you guys are doing?
Yeah, great question. You can call our office 631-343-4184. You can find us online too, coastalmdli.com. And then Instagram is another great spot for us as well too. So you can find Coastal MD on Instagram, and I'm more than happy to answer any questions that anybody has. On our website, there's actually a contact us form, and there's also an info email, which gets sent directly to me as well too. So it's a great way to get in touch with the practice as well as myself, to help everybody that we can, and looking forward to really be a good complement to all the power lifters, because I agree with you. This is once again the least amount of side effect and risk for the max amount of benefit for the long term. They just go so well hand in hand. So thank you so much for having me on your show. Looking forward to doing it again sometime too. Would love to dive deeper into some of these topics, because I was really getting going, and I'm like, reeling it back. I know that we could spend more time on this. So whenever you want to do another show, I'm more than happy to do another one.
Yeah. So and then we're gonna Coastal will be like we're gonna try to get them at some of our meets moving forward. So at the
Yep.
time of the recording, they're gonna be in they'll be at Insurrection, but we're definitely going to be kind of doing more stuff in the future. So definitely give them a follow. We'll include all the links in the description so you guys can check them out. Thank you guys so much for watching and listening. Until next time, stay strong, and we'll see you
Thank
soon.
you.